prescriptions can be pretty pricey.
We all know that, but there is some way you can save some money the next time you go to the pharmacy. Dan Leonard is the CEO of the Association for Accessible Medicines, and he explains the answer is buying generic drugs over their brand name competitors.
So the easiest way to think about this is there's no therapeutic difference between a generic medicine and a brand name medicine. The primary difference is cost. That's the critical difference, is the price of the generic is significantly less than the brand medication, but they are safe, effective. They undergo the same inspection processes as brand name medications. And they have the same clinical benefit, but the price comes down significantly. FDA has shown in their own studies that when 6 generic competitors come into a therapeutic area, the price comes down for off the brand medicine by 95%. Wow. So it's really the only component of healthcare where price goes down over time, and that's when generic and now more and more biosimilars come onto the market. That's where the big savings are for our healthcare system and patients.
Well, you just made me feel better, because I remember getting generic prescriptions and thinking, okay, is this just as good? So you just made me feel better about that. Also, you just released a new report detailing the economic benefit of generic and biosimilar drugs to American patients. So what are the findings?
So what we've found, and this has been going in the right direction over the last several years, but 9 out of 10 prescriptions dispensed in this country, 90%, are now for generic medications, yet generics only make up 18% of the overall cost of prescription medicines. So that means that 10% of the very high cost brand drugs are driving 82% of the cost. So what that meant for our healthcare system last year in 2020, $338 billion in savings for the U.S. healthcare system, $110 billion in Medicare, $53 billion in savings in Medicaid. So that's some big savings. When a brand medicine goes off patent and generic competition enters the market, that's when the prices go down.
And so is that the main benefit then for someone visiting the pharmacy counter, just the savings?
Well, so again, it's the same high quality medication, yet it's significant savings. So I gave you the big kind of system savings numbers for the patient at the patient level at the counter. The copayment, the average copay for a brand medication is $55. The average copay for a generic medicine is $7. So there's significant savings for the patient for the same high quality medication.
Okay, the savings, though, in the category of, drugs for treating cancer also stands out to me. So what can you share about that?
So this is where biosimilars are starting to take effect. Biosimilars are essentially generic versions of a biologic medicine, which is biologics are very high price. They're often infused or injected or administered in a doctor's office or a hospital for very rare conditions and many cancers. So what we've seen in just the last couple of years is the price of cancer treatments has been cut almost in half when biosimilars enter that market. So we're seeing that really we're on the front edge, the leading edge of the impact of what we will see in biosimilars for many years to come. In biosimilars, the system saved $7 billion last year, but that's going to be upwards of $125 billion in just a couple of years. So, significant savings in the biosimilars category.
And that's a game changer for some people. So where can we go for more information?
It is a game changer, very much so. And if people want to learn more about what I'm talking about here today, the impact of generics and biosimilars, they can go to our website, accessiblemeds.org. That's accessiblemeds.org.
All right. Thank you so much for your time, Dan. And if you'd like to see this segment again or get more information, go to firstcoastliving.net.